mention labral tear and few people know what you're speaking about, but the associated groin pain is something many can relate to.
It's typically a sharp pain right in the groin, and it's worse with sitting for a long time in a flexed position of the hip. Again, the internal, external rotation of the hip itself can elicit this pain.
The labrum lines the hip socket and acts as a cushion between the ball and socket of the hip joint when it's in a flexed position and holds the thigh bone in place. Unlike most hip conditions that show up in later years, patients tend to be younger.
Patients that I see are primarily younger, 20, 30-year-old males, and a little older, 30, 40-year-old for the females. There's a typical age range.
It's only been the last 10 to 15 years that doctors were able to pinpoint the cause of pain. Now they diagnose it early using specialized MRI and X-rays and may spare patients from having to undergo major hip surgery.
Historically, these procedures were all done using open technique. It's a big incision, big dissection, and now we can give them the same benefit with smaller incisions.
Surgeons now use an arthroscopic approach with a camera and small instruments introduced through a few small holes. They're able to go in and repair the tear.
Much like we do a meniscal tear, where we use a combination of anchors and sutures, and we repair that tissue right back down to the bone that it came from.
Patients can now be up and moving the same day. This less invasive technique shaves full recovery time from months to weeks. For Lee Memorial Health System, I'm Amy Osher.